The clinic that we're at today, oh, it was very easy. We had options on several clinics. We're doing operations in many countries around the world, and we have options and have had the pleasure of going to several different countries in Europe, the Middle East, South America, and working with top specialists in the field. So we really do have the pleasure of being able to work with, again, who we feel to be tops. In Dr. Choi's clinic here, it was a very easy decision. He had already demonstrated quite a bit of interest in this procedure. He's seen it before, he's done this procedure before, and it's quite evident watching him do the procedure that he has excellent dexterity with his hands, a keen knowledge base. Secondly, just the reputation that we've heard about from the clinic. A top-notch medical center, delivering state-of-the-art care. That's what I heard about before we got here, and that's been my experience here. By state-of-the-art care, the top procedures that we do in pain management in the United States and what we've seen around the world, they do here too. And along the same lines with that is this procedure here. I think it's safe to say it's cutting-edge medicine. It's a challenging procedure, and we need to have a top, very, very experienced specialist doing it. And so that's what we see. So I think it's a combination of things. The clinic reputation precedes itself. We've seen confirmation of that here. Top staff, very dedicated staff, a very knowledgeable specialist in there. And so what we want to do is advance this procedure. We find the best way to doing it is getting and working with top people. And I think that's the reason here. The Accuroscope procedure is the newest, best procedure for treating most types of low back pain. The history of medicine now, for the foreseeable future, a big push is to do what we call minimally invasive treatment. We hear about scope procedures. People will do a treatment of an arthroscope procedure in the shoulder or knee. We hear about laparoscopic procedures. And I think it's just common sense that the least we can do in making incisions and removing like bone and tissue, the better off we are. Well, now we're applying this same philosophy, this same approach to the spinal cord. Instead of making long, open surgical incisions and having to remove a lot of bone and the attendant risk involved, we are going to smaller and smaller procedures. I've worked with what I think are all of the newest top, what we call minimally invasive procedures, and a year and a half ago I was introduced to the Accuroscope procedure. And in my opinion, and the opinion of the other specialists that work with this, there's nothing close that can compare. We have an excellent high success rate in treating people with different forms of back pain, many of which, or most of which, otherwise would be facing open surgery, and we can accomplish the same, or what we feel to be better results in a safer manner by doing this without having to do surgery. It employs just a tiny nick of an incision, and we use a scope connected to a high definition monitor to show where we are in there, and then when we see something compressing or pinching a nerve root, we apply a laser treatment, and it gets the disc or whatever is pinching the nerve root to shrink away. It takes the pressure off the nerve. The patient has excellent pain relief, and we've done it in an outpatient setting with minimal anesthesia, and they're up on their feet and normal activity the next day. I was trained in this procedure a year and a half ago, and an honest estimate is it's taken about 200 times over the course of almost a year to develop a confidence in the facility of doing this procedure. I was doing them before that, but the point is it takes many procedures and a lot of training to become good and safe at this procedure. And on the basis of what we've learned, we're utilizing these lessons when we train the newer physicians coming in to do the procedure. So a well-experienced physician, for example, the physicians we've met here, including Dr. Choi, no question, they're going to be able to be very proficient at this procedure, yet it does take, again speaking for myself, considerably more training time and experience with this to develop the level of proficiency that we want for our patients. Well, I did mention with our experience, mine and the other physicians here with the pain clinic, Dr. Choi here, and it's, as I mentioned, excellent from all the different aspects of it. First of all, that's kind of our demand when we go places. We really only want to work with the top people, including the top clinics, and that's our experience here. We've been very pleased to a man about the quality of care at this place from every aspect. One is just the physical setting. Myself and Dr. Rothstein were commenting earlier just what a beautiful facility this is for patients to walk into. And what that means is not just the beauty of the facility, but from the way we see it, myself and Dr. Rothstein talking, is that the man or the group that will go through the kind of care to develop a center that just with an outward professional beauty for it, that's somebody that we see takes their job very, very seriously. It's a serious approach to the subject matter at hand, the philosophy of medicine. It creates a sense of goodwill on our parts. We're coming into a facility that people take medicine seriously. So that's very nice, just kind of an initial response to things. Well, that carries over to the people involved here. The professional staff, the administrative staff that we've had the pleasure of being here with and even enjoying meals with. Well, it's been very, very enjoyable, both from their standpoint, but also the pride that we see them take, professionalism maybe I should say, in their approach to this work, which goes hand in hand, we've seen earlier. Well, not just the outward physical experience, but appearance, of the facility, but when we get into the operating rooms, we see nothing but state-of-the-art equipment, standard. We feel we're used to what we consider to be the best United States in Dallas. Well, that easily matches what we see here, matches there. As a matter of fact, there's some of the things here we're so impressed with, we're getting the information so we can take it back to Dallas, Texas. One thing being very, very specifically the way the software is set up on the imaging in there, where they're able to capture images better than we're able to in what we think is state-of-the-art equipment in the United States. So very, very specific experience, but the overall appearance, what's nice is that it is all uniform. The appearance of the professionalism and the appearance of place, the professionalism, the devotion to excellence of the medical staff that we've seen here, both administrative as well as clinical staff, the standard state-of-the-art, cutting-edge equipment we've seen here, and then Dr. Choi, the medical leader of the place here. Well, we've learned in medicine, like I think most things, it comes down from the top. You see this type of excellence in all different spheres. Well, it has to be from a sense of excellence from, I think the medical leader here, at least that's what I would assume. I see this professionalism in him, both in just the way his demeanor in talking to us, his approach to the patients, his sense of perfection. He's driven in terms of a sense of excellence in doing the procedure. He's already has good skills at it, but he by virtue of the fact that he wanted us here, he wanted to get better. He wanted to work with other people. So it's been a very nice experience. All aspects of the physical plant, the equipment, the medical people, as well as Dr. Choi, are all uniform. It's been a complete pleasure.